Okay, so fat necrosis is decently common in breast surgery, and it can happen with all different sorts of breast surgery. So we often talk about fat necrosis with fat grafting, where we're discussing fat that doesn't take, and then it dies and forms a little clump. Fat necrosis from breast reductions, like you're asking about, is a little different. So when we're moving tissue around in the breast, somehow a portion of the breast loses its blood supply, or the blood supply isn't quite enough to support the fat and breast tissue in the area, and that area can die. So when that area dies, what you typically see is that the patient has a mass in the area, or a firm, painful, like nodule where that dead fat lives, or used to live. So the fat can actually be painful in a lot of patients when it dies, and that's from the inflammation around it. That inflammation can also lead to redness, so you can get a red spot over the skin, and then that red spot can masquerade as an infection. And so, experienced breast surgeons won't throw antibiotics at you, but often people who haven't seen this a lot will throw lots of antibiotics at patients when it's just inflammation from that fat dying. So the treatment of this is really a few different things depending on the situation. So the first thing is that a lot of areas of fat necrosis, if they're small, will just go away on their own. So there's nothing you really need to do. If this is decently soon after surgery, your body will often get rid of the little area of dead fat. Now, if this area is larger, there's a few other things we can do. So if it's close to the skin, you can actually use an 18-gauge needle, and you can aerate the area, and just kind of poking it a bunch of times brings blood flow into the area and can actually help process and get rid of that fat faster. Sometimes you can actually inject a little bit of 5-FU in the area, and for whatever reason, turning the inflammation off actually helps your body process the fat quicker. I do that sometimes in little small nodules. There are some minimally invasive ways to get rid of fat necrosis nodules. So there's a little thing called the Bard Encore device that can go through a tiny incision under ultrasound guidance. It can kind of rotate and chew up the fat necrosis and remove it. And then kind of the most extreme case would be that you just remove it surgically. So always a variety of ways to manage it. The important thing to remember is that it's not dangerous and won't harm you. So there's no emergency to it. So if you have this after surgery, it's often a good idea to wait, because like I said, a lot of these patients, it will just go away on their own. And then you can kind of figure out what to do in a couple months if it's still there. Usually we start with the more minimally invasive things and then jump to the surgical things if those things don't work.